My name is Anthony Murunga. I coordinate all activities on HIV control in the Tharaka County. HIV control program has a mandate to ensure that we achieve control of this disease by 2030. Because this is the vision of our country, as a county, we have an obligation to join the country in making sure that we achieve this vision. So as a county, we also have a vision to have a county free of HIV infections by 2030. And this is a huge task. I want to take this opportunity to remind people that we've not yet won against the fight. We've not won the fight against HIV AIDS yet. And the human behavior is sometimes when you get exposed consistently to a danger or something that is risky for a long time, you get used to it to the extent that you forget it was something that can pose danger to your life. And to me, at this point in time, this is the case with HIV/AIDS. We are almost starting to forget that HIV/AIDS is a health concern, and we started to focus on other things. Like this year, 2020, we have talked about COVID-19, and it has overshadowed other health concerns that we normally have, other things that pose risk to our health, to the health of our population. So with this opportunity, I want to remind everyone in the Tharaka County or beyond that we still have a task ahead to fight HIV/AIDS. And by this, I want to say that from the surveys that are usually conducted time over time, the Tharaka County currently has a HIV prevalence rate of 2.7%. Though this is a decline, or this is a decrease from what we have been having before, if we look at the trends, we're still not yet there. Because this means we have around 8,161 people living with HIV in the county. And as a program, we have a responsibility to ensure that we identify all these people and put them on treatment. And so far, as we talk, the Tharaka County, we have been able to identify 7,100 people, and we have linked them to all our, across our CCCs, or the comprehensive care centers that we have across the county, where they are receiving treatment and other services that they need to for their support in life. So among the 7,100 people who are on treatment or are enrolled in our programs across the county, 90% of them have already achieved viral suppression. And what this means, Sami, is that 90 people out of 100 of the ones that we have already put on treatment are living a healthy life. Because what we measure, or what we want to bring out as we measure the viral load in the blood of a patient after starting treatment, is whether they are responding well to treatment to restore their good healthy status as it was before infection. And if you have achieved viral suppression, that state of viral suppression, it means you're back to your good health, you have your immunity back, you can fight all the opportunistic infections which can easily cause morbidity and death to these patients, you can be able to fight it just like any other person without HIV. The other good thing is that the probability of you transmitting is very low, close to zero, transmitting to other people. So this is what we measure, and as Tharaka Nithi County doing 90%, we can say that we are doing well, but we still have some gaps because our target is 95% viral suppression. So if we can be able to manage those, getting all those people living with HIV, estimated to be living with HIV in our county, into treatment and ensure that they achieve viral suppression to the level of around 95% of that population, as a county, we will be celebrating that we are now surmounting this monster that we call HIV. But I want also to state that apart from identifying and putting people on treatment, the ones that are estimated to be living with HIV, we have a duty also to ensure that we prevent all the new infections, as it is captured very well in our vision for the program. So we have a number of interventions targeting to reduce new infections and ultimately to prevent all the new infections. One of the main interventions is a program we call Prevention of Mother-to-Child Transmission. This is a program that is geared towards ensuring all the children born to HIV-positive mothers are kept safe from getting the virus from their mothers. And we ensure this by, first of all, testing all the pregnant mothers for HIV. For the first visit, they come to our facilities, so that if you are HIV negative at that point, we take the mother through education on how to ensure that they prevent themselves from getting the infection during pregnancy and even thereafter, so that in that state we are sure the child does not get the virus from the mother. For those who test HIV positive, after we test them, we put them on a program of ARVs. And we also provide some ARVs for the unborn child, so that immediately they are born, they are also started on some medication. And this medication is basically to ensure the health of the mother and minimize the probability of the mother transmitting that virus to the child. And as a county, I can say we have seen a lot of good results through this program. So many mothers have come who are HIV positive, and they have graduated out of this program with HIV negative children, which is a very good thing. And I can say that for all the tests that we normally conduct for those children who are exposed to HIV by their mothers, only 1.8% turn out to be HIV positive. For those who have been enrolled in our program, we have 1.8% who turn out to be HIV positive, mostly because they came to our health facility late, or they did not come at all until maybe the child got positive before they present themselves to our health facility. So I also want to say that for those who do not come, because we know it's not all the mothers who seek services in our health facility, which is now also a concern that we all need to address. It is estimated that because of that factor of some mothers not coming to seek for the services, and some of them are HIV positive out there, there is a mondial statistics that tells us with that factor included, our mother-to-child transmission rate rises up to 11.4%. So if you look at the data in our facility and the modeled estimates, it tells you that there is a huge impact on our indicators because of people who do not seek services in our health facility. This is an area that we are working hard to address by working with the community health volunteers that were brought on board through the initiative of our governor, His Excellency Bwana Muthomi Njuki. And we are very optimistic that working with the CHVs, this message of trying to change the health-seeking behavior from the community level will significantly change. And there are all the indicators that are pointing to that after we started engaging the community health volunteers. So that is a program that has really worked well for us in terms of prevention of new HIV infections in the county. We also have a program that is targeting the key population because from the surveys again, it was noted that most of the new infections are linked or attributed to somehow to the key population. Who is a key population? The key population are people who are at a higher risk of either getting HIV or transmitting the infection to another person. For example, the sex workers, the people who sell sex as their business. And we have a lot of them in the county. So far, we have identified close to 3,000 that we are working with them in our program. And what we are doing with these people is to ensure that we give them all that they require to protect themselves from getting the HIV infection, and also at the same time to protect the next person who is their customer from getting the HIV infection. Because this is a pool of infection where most of our people from the general population get the infection, or they deposit the infection for more transmission. So we have that program, and that way we have seen a trend of reducing new infections from 2015, when it was around over 400 new infections in a year, and currently, as per 2019 estimates, we earned 164 new infections in the county. So that is not the best. Of course, we have to work hard and ensure that the new infections are reduced to zero or to almost zero, so that we can celebrate having achieved HIV control in this county. For us to be able to achieve all that we have achieved as a program, I want to attribute this to the good leadership of this county. As that, if we look at our trends, by the end of year 2017, our curves had already started dipping because of the challenges that we are having of the healthcare providers being away from their workplaces for a long period of time. And that was compromising the quality of services that we are giving to our clients. So, since 2018, because of the consistency of the healthcare providers being in the health facilities, we again saw our indicators going up, and so far that momentum has been maintained, and we are looking forward to very good indicators in the next few years. So good leadership can majorly be attributed to the good health indicators, specifically for HIV that we are witnessing in the county.